events and issues shaping our community. This is Comcast Newsmakers.
Comcast Newsmakers is on the road. We're in the plaza of the state capitol for this special edition of Comcast Newsmakers on Children's Week. And our guest this hour, Pam Bergsma. She's from the Joey Bergsma Retinoblastoma Awareness Foundation. And thank you very much for joining us. Now, what most people don't realize that 1 in about 9 children leave the hospital with some sort of sight irregularity. That's amazing. That's a high number.
Yeah, it's actually 1 in 9 presenting in that first year of life is showing a concern. And this is why we have the infant eye care bill. After my grandson Joey had passed away needlessly because he was denied the standard of care at his 18-month exam, we realized that with the newborns, there's eye disease is too prevalent at birth. We need to enhance that standard because their pupil is so small in diameter, with it just less than a dime to do this. We just dilate the pupil, and it takes a nurse just a few seconds of time. So there's no reason not to do it.
Talk about retinoblastoma for a moment here.
Okay.
What should parents look out for, especially with small children, babies?
Okay, well, the clues for retinoblastoma are the same clues for all the other eye diseases that could be developing on the back of the retina. We want to look at our photographs. We learned the hard way that you can actually photograph an eye disease. If a child has an ocular disorder, we've got a 60% chance of actually getting that on film with flash photography. When the dim lighting, when the flash goes off, the back of the eye is reflecting the light. That's where that lousy red reflection comes. You've actually taken a picture of the retina. So if you have something developing back there, like a retinoblastoma tumor, it will block that retina from reflecting red. It will appear whitish usually, but it can be yellowish, bluish, greenish. But if you ever get an odd picture, flash picture with a glow in one or both eyes, especially if it's a child from birth to 5 years of age, we want to get that child immediately to an eye doctor. You could be saving their sight, you might even be saving their life.
So what we're talking about here is a very treatable disease if you catch it early.
Yeah, retinoblastoma is the best pediatric cancer a child's going to get. It's 100% fixable in the early stages in the eye. We give the children 20/20 vision. But on the other side of it, if we don't detect and we allow it to escape out of the optic nerve, it is the worst cancer. There's a 0% chance to survive.
This is the key to detection.
This is the key for all of our children having the best sight possible when they start school.
Okay.
At every exam, just like a stethoscope for your heart, this is probably even more important. We need to make that room black, dark, like the inside of a closet, and then the healthcare professional needs to take the 15 seconds to look. If they only listen to one heartbeat, they wouldn't detect. If they just see red and put this down, they haven't looked. We have to make sure they take the 15 seconds of time to look thoroughly on the back of the eye.
And what are you doing here in Tallahassee? You're trying to have legislation to enforce that?
Well, we've had a bill ever since Joe died, but sadly, we almost did this in 2002 and again in 2003. And tragically, our bill in the House never gets to be heard. In the last 3 years, we haven't had one in the House. Senator Wilson's been filing it in the Senate every year. This is asking for that enhanced standard for the newborn. It's called the infant eye care bill. At birth or within the first 2 weeks, at 6 to 8 weeks, and again at 6 to 9 months. And those 3 enhanced exams should get the vast majority of all these babies to give them that sight that is their birthright.
Okay.
It's simple. We should do it. There's no reason not to.
So it's all about detection in the early ages? The key ages we're looking at is what, 1 to 5?
We're concentrating in my organization on birth to 5, but from 5 to 18, from 18 to 100, at any time in our lives, we can develop something that's going to take our sight, and by the time we realize it, it's too late to reverse it. So early detection, this is how even we will get to that eye doctor in time to save our sight. So this is the key, the eye dilation exam for those babies, and then alerting the parents to their photographs. Irregular eye movement, very important.
Okay.
Red, watery, itchy eyes. Too many times a child has a cataract or an eye disease, and they're put on pink eye medicine or allergy eye medicine, and here they're going blind and might even be losing their life.
All right, well, thank you very much. This hour's newsmaker has been Pam Bergsma from the Joey Bergsma Retinoblastoma Awareness Foundation. I'm Spiro Canton here on the plaza of the state capitol in Tallahassee, and we thank you for joining us.